Three more tests in this phase. So today you wrote test number 29, 13, no 29, 29. Three more tests by the end of December, that would be 32. So that is technically half of your preparation. Half of the preparation in 6 months and rest of the half in another 6 months. January onwards, from next visit onwards, all the senior faculty also will be doing paper-based discussions. Like I told you, all of us will start dealing with the papers, starting from the first paper. The first 13 papers are your previous year papers. So those will be your solid backup for your attempt. Alright? So, apart from that, morning 6:30 to 8:30 will be numerical time. Every day, starting from January 1st, every day it will be 1 hour 15 minutes of physics numericals for 1 hour 15 minutes. Physics numericals, and for 45 minutes chemistry numericals every day. And what numericals? So far you have been trained in some basic mathematics. Now we need to start applying that. I told you from January onwards we have to start doing numericals in both physics and chemistry. Alright? So from the papers only, from whatever papers you have attempted, numericals will be solved by your resident faculties. They will help you solve the numericals. And when the senior faculties are, they will also touch upon it and they will give you more views on how to solve the numericals. Alright? So the idea is senior faculties will be able to solve about 20 to 25 papers through and through. So by your own efforts, your own post-test analysis, you should be completing about 30 papers at least. About 30 papers. So whatever we do till December end, those are the papers you should be thorough with by your post-test analysis. Some notes there. We will also be giving you some tables and short small things that you have to remember. Now will be the time when you will be given material from our side also. Now that you have built material on your own, you have learned to do it, you will start using the material that we will also give you. The shortcuts, tips and tricks, things that will help you score more. Those are the things that will be focused on for the next 3 months. January, February, March. April, completely support as per need. You need some support at some point of time, that will be the only support that will be provided. Rest of it will be complete revision of whatever you have built, whatever we have done. So 3 months of numericals every day for 2 hours in the morning should be able to train you enough for solving at least 40 to 50% of the numericals that might come in the paper. Alright? Don't push yourself to be prepared for all the level of difficulties of numericals. Go to the level of difficulty, whatever is comfortable for you and whatever those 2 months can train you on. Alright? So focus on that, focus on that. Keep working, complete your notes. Linear notes should be over. You should stop doing it now. By the end of December, you should stop doing it. You should start focusing only on post-test analysis. Post-test analysis, alright? And solving the papers will be done by faculty also. From the first paper, starting from the first paper. 30 papers, you will also do it. Resident faculty will help you solve the numericals. Senior faculty will have discussions on all the questions of these 30 papers. Should be more than enough. 10 to 15 papers thoroughly discussed should be more than enough. Okay? So if we are thorough with the discussion on all the previous year papers, not starting from 90s, 2013 onwards, 2013 to 2024, we will be well prepared. Okay? This is the time when you will start going into cycles of fear, anxiety and self-doubt. Don't fear, don't go into anxiety, don't worry about outcomes, don't doubt yourself. Doesn't matter, you are still yet to cross 200, doesn't matter, stick to the process. Stick to the process, put in the time. Alright, you have walked a certain distance, you have already come a certain distance, things will start becoming significantly better. Alright, no anxiety, no worries. Alright, yes? As the calendar changes, 2024 is the year prior to your exam year. The moment calendar changes to 1st January 2025, your mind will start playing games. The year of the exam will start rapidly coming. It will start coming towards you. Don't fear. Alright. The next 3 months, how happy you will stay will determine how well you will perform. Alright. You have to trust your own preparation. Okay. We will do health and diseases. We will finish human health and diseases. Then we will complete ecology. If you can push a little bit, try to gain a little more time during the breaks also. During the break, maybe 15-20 minutes if you can gain. I have seen some of you study in the library during the breaks. Good. Whatever you can push beyond the regular scheduled routine, push a little. Alright? See, the health and disease. What is health? WHO definition of health is a state of complete physical, mental, emotional and social well-being and not merely an absence of disease or infirmity. Disease means what? What is disease? Not feeling at ease. Anything that disturbs your state of ease, feeling at ease with yourself is dis-ease. Not feeling comfortable, not feeling at ease with yourself. Okay, that is disease. The disease can be clinical or subclinical. You might be feeling uncomfortable and your physiological functioning might be affected. If your physiological functioning is affected, then you are in a state of disease. Then you are in a state of clinical disease. If you are feeling uncomfortable, that is you are uneasy, but you are not. Your functioning is not affected. So we don't call it a clinical disease, we call it a subclinical illness. Disease, illness, all of these are terms that we use interchangeably. What all can be the cause of disease? Commonly we categorize diseases into two categories. Diseases or illnesses caused due to infection. Diseases caused due to other factors, non-infectious. Infectious diseases, non-infectious diseases. Infectious diseases is a war between organisms. Some organism wants to colonize your body and wants to make use of the resources of your body to grow and multiply and reproduce. That is what the organism is trying. Your body's immune system is trying to fight it and overcome the challenge posed by the organism. So that is your immune response. So there is always a conflict between immune system and the agent that is causing disease. The agent can be infections, the agent can be injury, deficiencies, nutritional deficiencies or genetic abnormalities. Any of the reasons can be the cause of illness and disease. So we will go in the reverse order. We will try to understand immunity. What helps you fight, what helps you stay healthy, and then look at what are all the things that can disturb it and how diseases happen. There are two theories for causation of diseases. One is, especially for the infectious diseases. Infectious diseases, there are two theories. Both are opposite in their approach. One says an external agent of infection, that is an infectious agent or a microorganism, attacks your body and that is what will cause the disease. That is the germ theory. germ theory for disease causation. The other one is immune system theory. That is, your body has become weak, which makes it feasible for the organism to attack you. Which one do you want to agree with? And a microorganism attacks your body and makes it weak. The other theory is, your body has become weak and therefore the microorganism attacks you. Or the microorganism is able to cause disease. Which one do you think can be the right explanation of infectious diseases? There is a microorganism attacking you, therefore disease, or body has become weak, therefore microorganism attacks you. Both can be factors. See, whenever a microorganism enters your body, respiratory illnesses, there are millions of microorganisms around us as we are talking in this room. Now these microorganisms can enter your body. They are trying to catch hold of your body. They are trying to establish their colonies there. But your immune system is fighting it. We will not even realize that the infection has occurred. On the other hand, the microorganism, you will start feeling that disease, whether it is cold or cough or fever, whatever, is when the microorganism takes over. So when the balance is tilted in favor of somebody, that will be manifested. If the balance is tilted in favor of your immune system, there will be no manifestation of the disease. If your balance is tilted in favor of the microorganism, the disease manifests. Alright? Okay. So we will go through. This is a big chapter. We will read it and then touch upon the concepts. Health for a long time was considered as a state of body and mind where there was a balance of certain humors. Humors means fluids or some chemicals. This is what early Greeks like Hippocrates as well as Indian Ayurveda system of medicine asserted. It was thought that persons with black bile belonged to hot personality and would have fevers. This idea was arrived at by pure reflective thought. Reflective thought means what? You observe something and you correlate it to something which is commonly appearing in a particular set of conditions. Alright? The discovery of blood circulation by William Harvey using experimental method and the demonstration of normal body temperature in persons with black bile using thermometer disproved the good human hypothesis of health. There are good fluids and bad fluids. Presence of good fluids will keep you healthy, and when the good fluids turn abnormal, you will become ill. That theory was disproved. In later years, biology stated that mind influences through neural system and endocrine system our immune system, and that our immune system maintains our health. Hence, mind and mental state can affect our health. Mind and mental state can affect our health. Of course, health is affected by genetic disorders, infections, lifestyle. Okay. See, there are disorders. There is always a component of mind on illness, the experience of illness. Psychosomatic disorders. So, like many students experience headaches during exams. Right? Some students might even experience bouts of diarrhea before exams. On the day of exams or before exams, suddenly they will have exam diarrhea, exam fever. Right? How is that happening? These are called psychosomatic disorders. Psycho means psychological component. Somatic means body. Psycho is a reference to psychology, but the mind, and somatic is a reference to the body. Disorders occurring in the body by the influence of the mind. Have you experienced, some of the parents call me and your parents tell that I have to take my son to the checkup, my daughter to checkup. We have to take her or him to that particular doctor only. Since childhood, that doctor is treating my son, my daughter. So they come here, take an overnight journey to go and get a regular checkup done. So you can't see. My father is also a doctor. So people travel 200 kilometers or 150 kilometers to go and get some medicines from him. The cost of medicines would be about 200-250 rupees. for about 10-15 days. And the cost of their travel would be 2,000 rupees. So it's like you feel comfortable, you feel happy when you interact with certain people. The state of mind influences the experience of illness. So health, as defined by WHO, is a complete state of physical, mental, emotional and social well-being, and not merely an absence of disease or infirmity. Just because you don't have a disease, it doesn't mean you are healthy. Okay. It's still not working on. But it will take time. Anyways, I'm audible. I'll keep it, if it might start working magically sometime. Or at least it will be good for optics. Health is affected by genetic disorders, deficiencies with which a child is born, and deficiencies or defects which the child inherits from parents from birth. See, there are two types of genetic disorders. One is inborn errors. That is, the child is born with some errors or defects. It can be congenital errors, congenital disorders. It can be genetic disorders also. Are all congenital disorders genetic? Congenital disorders means disorders which the child is born with. Should it always be genetic? Can there be congenital diseases or disorders which is not genetic? Congenital and genetic are not the same. Have you seen children with cleft lip, cleft palate? There is a cleft in the lip. These two parts of the face develop separately and they fuse in the center. But in some children the fusion does not happen and the child is born with cleft lip. It is a congenital disorder. Cleft lip and cleft palate are congenital disorders. It may not have any genetic basis. It is not because of the defective genetics. Then why did it happen? It is not because of some defects in the chromosome or genes. Why did it happen then? Any disruption in the stages of development during pregnancy, when the child is developing in the womb of the mother, if there is anything that obstructs the development for any period of time, the development that was supposed to happen in that period of time will be stopped. When that influence which is preventing the development is withdrawn, the development continues, but whatever was missed will not be completed. That means whatever development needs to happen at 10th week of pregnancy will happen in 10th week. If some drug or some other influence is obstructing that development of 10th week and it is not there in the 11th week, the development of 10th week will not complete and then 11th week will begin. It will leave it there and the 11th week development continues. Understand? That is why during pregnancy you don't prescribe or you don't allow women to take any random drugs, any random medication. Even to take a small paracetamol for headache, it has to be by the prescription of the doctor. Many drugs can cause problems in pregnancy. Alright? So genetic disorders, congenital disorders, they are different. Infections, lifestyle, including food and water we take, rest and exercise we give to our bodies, habits that we have or lack of it, etc. There are three things that needs to be taken care of in lifestyle which will influence health. Number one, food. Number two, your physical activity. Number three, your rest. Food will ensure your optimum physiological functioning. Physical activity will ensure your optimum metabolism. And adequate rest will ensure your proper recovery. So, physiological functioning, adequate metabolism and recovery. These are the three things you have to take care on a daily basis. Lifestyle modification is to ensure that these three are taken care of. Food, physical activity and rest. The term health is very frequently used by everybody. How do we define it? Health does not simply mean absence of disease or physical fitness. It could be defined as a state of complete physical, mental and social well-being. We discussed this. When people are healthy, they are more efficient at work. This increases productivity and brings economic prosperity. Health also increases longevity of people and reduces infant and maternal mortality. See, what is infant mortality and maternal mortality? Infant mortality and maternal mortality.
Infant mortality, the death of children below the age of 1.
Below the age of 1. Death rate of children in the first month?
Still count.
Do we have to consider it as infant mortality? Do you consider it as infant mortality?
Yes.
That is also another important parameter. Birth to 1 month of age, post birth, is called neonate. That is the neonatal stage. Neonate means newly born child. Newborn. Newborn is up to 1 month of age. 1 month to 1 year is infant. 1 year to 3 years is what? 1 to 3 years is what? Child. Everybody is a child. You are also a child to your parents. 1 to 3 years is toddler. 3 to 6 years, 3 to 5 years is preschool. Preschool child. Okay. Then consider 3 to 6 years as preschool child. 6 to 12 years is considered pre-adolescence. Then 12 to 18 or 13 to 18 you can consider as adolescence. 18 to 24 young adults. Okay, that's all. 24 onwards you are a not so young adult. Okay, rest all doesn't matter. These stages are important for development. These are developmental stages. Up to 1 month after birth, in the neonatal stage, there are high risk of problems arising because of hypothermia. The child has not yet developed adequate mechanisms to withstand cold, loss of temperature. So the child has to be kept warm. Children can die because of hypothermia. 1 month to 1 year of age in the infant stage, children are prone for developing infectious diseases if not supported by the mother's milk. Up to 6 months, the mother's milk is the source of immunity for the child. By that age, by 6 months, most of the vaccinations against deadly diseases have been administered. So the child is protected. Nutritional status impacts the way mothers will be able to nourish the child. If the mother is malnourished, the baby is affected lesser compared to the mother, because the natural mechanism is to ensure that the baby is provided nourishment at the cost of the mother. Malnourishment can lead to death of the mother than the death of the infant. The probability of the death of the mother is high than the probability of the death of the infant, because nourishment of the child is at the cost of the mother. That is nature. Alright. Young lives are protected by nature than older lives. That is more, that increases the chances of survivability of the species. Alright. So infant mortality is the death of children between the ages of 1 month to 1 year of age per 1,000 live births. For every 1,000 children who are born alive, how many children are dying? That is infant mortality rate. Maternal mortality rate is also the same. The death of mothers per 1,000 mothers who deliver. Pregnant mothers. For every 1,000 pregnant mothers who deliver, how many mothers are dying? Infant mortality and maternal mortality used to be very major concerns in our country for a very long time. Now it is stabilizing. Still we have high infant mortality and maternal mortality compared to global standards. Balanced diet, personal hygiene and regular exercise are very important to maintain good health. These are all basic things. Yoga has been practiced since time immemorial to achieve physical and mental health. You have all found the excuse of cold to sleep half an hour more. Okay. You should wake up and do it. What you have been practicing, you can practice it in your room. The next 3 months is the time when you will need it the most. Okay. So don't escape, don't skip. I cannot deny the request for not having it outdoors in the morning, but you have to do it. Okay. I know it is an excuse. Awareness about diseases and their effect on different bodily functions, vaccination, immunization against infectious diseases, proper disposal of wastes, control of vectors and maintenance of hygiene in food and water resources are necessary for achieving good health. These are all general principles, students. You can answer questions on these things by general common sense logic. All of you know all of these things. Specific things, when we arrive at in the book, we will elaborate on things. When the functioning of one or more organs or systems of the body is adversely affected, characterized by appearance of various signs and symptoms, we say that we are not healthy. What is the difference between sign and symptom? Whenever you talk about diseases, you talk about signs and symptoms. Question has come on this. What is the difference between sign and symptom? What is fever? Is it a disease or a sign or a symptom? Is fever a disease? No? Then what is it?
Symptom.
Symptom. Okay, what is a symptom?
A consequence of the disease, of the infection.
Consequence of the disease of the infection. Okay. What is a sign? Signature of the disease. What are signs of a disease? What are symptoms of a disease? And what is a disease? Is fever not a disease?
High body temperature is the sign, and feeling unwell is the symptom.
Okay. High body temperature is a sign. So what you pick up on a thermometer is a sign. Partially correct. Symptoms are those which the person experiences. You will have the patient come and tell you, sir, I am not feeling well. I have headache, I have fever. Fever, they will come and tell you. It is not that they come to you telling that I am not feeling well and suddenly you tell them you have fever and they will realize, oh my God, do I have what fever? Doesn't happen that way. They will come and tell you. What a person himself or herself can realize about them. These are all signs of Klinefelter syndrome. When you correlate all of this together, it indicates you to something. Syndrome is not a disease. Syndrome is a collection of involvement of multiple organs. When multiple organs are involved, multiple systems are involved, then you call it a syndrome. So AIDS is a syndrome, acquired immunodeficiency syndrome. There are multiple stages. Initially it will be non-specific disease. The person will start having fever, unexplained fever. Suddenly fever, the person will become feverish, is constantly ill, frequently ill. Then you will start having AIDS-like symptoms, which is immunodeficiency symptoms. Lymphadenopathy, lymph nodes are enlarged at multiple places. You are not able to identify a locus of infection. If a lymph node here is inflamed, if a lymph node in any part of the body is swollen, in the area of its drainage, you need to find some source of injury or infection. If the throat lymph, if the tonsils are inflamed, you should have some pharynx or the oral infection. You will find it if you examine. But unexplained. You are not able to find the locus of infection, but then the lymph nodes are enlarged. Okay? So when it goes into full-fledged or full-blown AIDS, then multiple organs are involved, multiple tissues are involved, being affected because of reduced immunity One type of cancer is very specific to AIDS. Can anybody tell me what is that cancer?
Blood cancer.
Huh?
Blood cancer.
No. Kaposis sarcoma. Kaposi. Make note of it. Questions have come on this. This is a very specific type of cancer that you will find most frequently in AIDS patients, in HIV infected patients. Kaposi, Kaposi. Kaposi, Kaposi apostrophe S, Kaposis sarcoma. Alright. Commonly found in HIV infected patients. Okay. Among non-infectious diseases, cancer is the major cause of death. Drug and alcohol abuse also affect our health adversely. Common diseases in humans. A wide range of organisms belonging to bacteria, viruses, fungi, protozoans, helminths, etc. could cause diseases in man. Such disease-causing organisms are called pathogens. Pathogens. Pathology is the study of diseases. Pathology is the study of diseases. Most parasites are therefore pathogens as they cause harm to the host by living in or on them. The pathogens can enter our body by various means, multiply and interfere with normal vital activities, resulting in morphological and functional damage. The portal of entry, mechanism of disease causation is very important. Portal of entry is how is this pathogen commonly entering the body. What is the portal of entry or mode of infection in typhoid? What is the portal of entry or mode of infection in typhoid? Portal of entry is what? Mouth. Mode of infection? Contaminated food and water in typhoid. Correct? Pathogens have to adapt to life within the environment of the host. For example, the pathogens that enter the gut must know a way of surviving in the stomach at low pH and resisting the various digestive enzymes. It is not easy to survive. What is the pH of stomach? Gastric juice. pH of gastric juice? Around 1.5. 1.5 pH is extremely acidic. So a pathogen at 1.5, think about a cell having to survive pH of 1.5, it is very corrosive. If the same gastric juice is taken out and put on your skin, it will burn a hole into your skin. So these organisms which enter through the oral cavity should have developed the mechanism of surviving the gut environment. Not only the enzymes of the stomach, even the enzymes of the small intestine, the pancreatic enzymes are also highly corrosive. But they are not acidic. They are corrosive on the alkaline side. Highly alkaline, 8.5 to 9 is the pH of that. That is also damaging. Okay? That is why pancreatitis, what happens? Pancreas is supposed to produce enzymes. They are produced in the form of zymogen granules. Inactive granules which will get activated in the, where does the enzymes of pancreas get activated? Where does it get activated? It gets activated in the small intestine. It gets activated in the small intestine. Small intestine is designed to withstand the effect of these damaging enzymes. They have to break down powerful digestive enzymes. What are they digesting? You eat meat. Meat is to be digested. It has to be broken down into pieces. Broken down chemically into its smallest, minutest of components. What you have inside your body is also meat only, no? The same things that you eat. If the same enzymes are acting on your own body tissues, it should be able to digest your body tissues also. Correct? It doesn't happen normally because those enzymes are activated in places where they are supposed to act. The enzymes are supposed to act in the small intestine, they are activated in the small intestine. If they are activated in the pancreas itself, it will eat away the pancreas. That is pancreatitis. And it can puncture holes in the pancreas, it can form holes in the pancreas by burning it, and the enzymes can get into the abdominal cavity. Whichever organ it comes in contact with, it can just cause damage to those organs. So we have a bomb here, waiting to explode. Pancreas. Pancreas explodes, the person takes off. Alright. The current Chief Minister of Karnataka. Any idea? No. He is a person by name Mr. Siddaramaiah. Okay. His son died because of pancreatitis. Chief Minister, when he was Chief Minister only. So, deadly disease, it can just, nothing external, internal, the enzymes get activated within the body, they can kill. Alcoholism and gallstones are the two important causes which can cause pancreatitis. So, if you are constantly drinking alcohol, you increase the chance of developing pancreatitis. Or if you have gallstones, if you are prone for gallstones, that can also trigger pancreatitis. Don't drink. Okay, surrender all your stock today. Okay. A few representative members from different groups of pathogenic organisms are discussed here along with the diseases caused by them. Preventive and control measures against these diseases in general are also briefly described. See, remember the pathogen and the disease it causes. What are the main symptoms that you will find in this disease? That's all. Don't go too deep into it. You are not studying pathology in MBBS. You are studying pathology to get into MBBS. So understand what is required. Salmonella typhi. Salmonella typhi is a pathogenic bacterium which causes typhoid fever in human beings. These pathogens generally enter the small intestine through food and water contaminated with them and migrate to other organs through blood. Typhoid caused by Salmonella typhi enters through contaminated food and water. So first infection it causes is of the intestines. It will multiply in the intestines and then enter into the bloodstream. What will happen? Sustained high fever, weakness, stomach pain, constipation, headache and loss of appetite are some of the common symptoms. Intestinal perforation and death may occur in severe cases. Why intestinal perforation? Why will intestine get punctured? There is immunity at the level of the intestine also. So the immune system, the cells of the immune system are trying to attack these bacteria at the level of intestine only. So that battle can lead to necrosis of the intestine. Necrosis means what? Necrosis means dying, death of the intestinal wall tissue. And that becomes susceptible for attack of the enzymes which can cause perforation. Right. Intestinal perforation is an emergency. Okay. Remember the test for typhoid fever? The test for typhoid fever is Vidal test. A classical case in medicine, that of Mary Mallon, nicknamed Typhoid Mary, is worth mentioning here. She was a cook by profession and was a typhoid carrier who continued to spread typhoid for several years through the food she prepared. How? You know the story? Do you know the story of Typhoid Mary? No?
No.
See, she is a carrier. What is a carrier of a disease? Who is a carrier of a disease?
She has the disease.
She has the disease. She has the disease causing agent, but she is not expressing the disease. But all the while she is infective. She does not experience the disease, but she can pass on the disease. That is a carrier. Okay? But if she is carrying the disease, how is she actually passing it on to people for years? What did she do? Where does the Salmonella typhi colonize? Where will it stay? In the intestines. In the intestines, there is a lot of pressure in the intestine, which will make the Salmonella typhi also get excreted in the feces. She was a food handler. She used to run a busy restaurant. She did not have enough time to wash her hands. Imagine how much of disease transmission happens because of bad hygiene. Okay. You know what is the root called? Root of infection for typhoid is called feco-oral route. What does that mean? The disease causing agent is being excreted in the feces of the affected individual, from which it goes into the mouth of the person who gets infected. It is not the bacteria jumping from the feces and getting into the mouth, no. It goes along with the medium. Why it is important to eat at hygienic places. It doesn't matter who is cooking, who is preparing food. The person who is preparing food is a very poor street vendor. I have to support him. Doesn't matter whoever it is. Anybody who handles food has a duty to handle the food hygienically. Hygiene does not cost money. Hygiene costs sense. That's all. So, typhoid Mary, we don't know how many typhoid Marys are present everywhere. In the form of chat shops, street food. All of typhoid Marys are there, all over. Okay. They have not mentioned here. They have just mentioned she was a cook by profession and was a typhoid carrier who continued to spread typhoid for several years through the food she prepared. Sounds like she was consciously trying to contaminate people. But inadvertently she would contaminate because of her poor hygiene and she did not even realize. It's a very interesting story. Typhoid cases started increasing in that particular region. The public health officials, the public health department's job is to find out, is there any community-based causes for this? They started investigating. And started taking history from all the cases. Majority of the cases had one common connection, that all of them were customers of this particular restaurant. Then when they went and then they started checking for all the food handlers and all the staff in the restaurant, they found out that Mary was a carrier. Okay. Bacteria like Streptococcus pneumoniae and Haemophilus influenza are responsible for the disease pneumonia in humans, which infects the alveoli of the lungs. As a result of the infection, the alveoli gets filled with fluid, leading to severe problems in respiration. The symptoms of pneumonia include fever, chills, cough and headache. In severe cases, the lips and fingernails may turn grey to bluish in color. A healthy person acquires the infection by inhaling the droplets or aerosols released by an infected person, or even by sharing glasses and utensils with an infected person. Dysentery, plague, diphtheria, etc. are some of the other bacterial diseases in man. See, typhoid, remember, all the diseases marked in the book, you have to remember. Typhoid you have to remember, pneumonia you have to remember. Pneumonia is more likely to come as a question because even COVID caused pneumonia. Pneumonia is a reference to any disease where alveoli are affected. Alveoli in the lungs are affected and alveoli gets filled with fluid. What will happen if alveoli gets filled with fluid? What fluid is that? That is inflammatory fluid. Whenever there is an inflammation, there are signs of inflammation. What are the signs of inflammation? Increased temperature, redness, swelling, that's all. Increased temperature, redness, swelling and pain. Four signs of inflammation. It's like if you just scratch your skin by your fingernail, scratch it hard, then you will see there will be a swelling in that region where you have scratched it. It becomes red. It will not be noticed in my skin. Alright. Many of you can notice that. Alright, and it will, there will be pain also, and there will be increased temperature if you can measure it. Same thing, the infection goes to the alveoli. See, from nostril to the alveoli, it is a long journey. It is a long journey. Not all pathogens can reach the alveoli. Some of them will get stuck up in the upper respiratory tract. So they cause upper respiratory infection, pharyngitis, throat pain. Some might get into laryngitis. If laryngitis happen, the larynx is the voice box. The person's voice will get affected. He will not be able to, the voice becomes hoarse. Sound box will get affected. Many will get into trachea, throat irritation, and upper respiratory, that is also upper respiratory. When it gets into bronchitis, bronchioles, that is also bronchitis kind of symptoms only. Then if it goes into lower levels, higher levels of bronchioles and alveoli, where it goes into the smaller tubes within the lungs, the inflammation will cause fluid accumulation. Even in the upper respiratory tract or in the bronchi, there will be inflammation. But the fluid produced will not be so much to block that passage. You will have respiratory difficulty, but not distress. You understand? But if it is in the alveoli, there will be distress. Pneumonia causes obstruction to the air exchange, gas exchange barrier. You have that alveolo-capillary membrane where gas exchange happens. If it is covered with fluid, gas exchange does not happen. So the person will experience anoxia, that is lack of oxygen supply to the blood, breathlessness. That is why COVID patients, if you have seen, they would struggle for breath. And when you give oxygen, how it will help? Whatever alveoli are still functioning, they will get air with higher levels of oxygen or higher partial pressure of oxygen, which will help in oxygenating the blood better, creating some relief, causing some relief. If pneumonia does not clear, the person might die of respiratory distress. It's called ARDS, acute respiratory distress syndrome. You can make note of it. Pneumonia eventually will lead to ARDS, acute means sudden, respiratory distress syndrome. Respiratory distress means the lungs will not be in a position to bring about gas exchange, leading to anoxia, death. What is hypoxia? Hypoxia and anoxia are two different terms. Hypoxia is lack of oxygenation of the blood. Anoxia is, or decreased oxygenation in the blood is hypoxia, hypoxia. Anoxia is no oxygenation. Severe pneumonia can cause this. Okay. All respiratory infections are not pneumonia. Pneumonia is a very severe form of respiratory infection. Many viruses, what is the difference between dysentery and diarrhea? Both have loose stools. Loose motion happens in both dysentery and diarrhea. What is the difference between dysentery and diarrhea? Both are loose stools, but in dysentery, there will be blood and mucus in the loose stools. Okay? Loose motion with blood and mucus is dysentery. One common pathogen which causes dysentery is Entamoeba histolytica. Entamoeba histolytica. Amoebic dysentery. Okay? What it does, it will catch hold of the intestine. It will catch hold of the surface that it comes in contact with, digs into it. It digs into it. So when it catches hold of the intestine and starts digging into it, what is it removing first? It is removing the mucosal covering on the intestine, which will make the mucus get into the stools. And as it digs further, it is trying to get into the bloodstream. As it digs further, it is eroding the intestinal wall. When it corrodes the intestinal wall, when it erodes the intestinal wall, it opens up some blood vessels, blood capillaries in the intestinal wall, which will lead to bleeding into the intestine. So blood and mucus. If there is blood and mucus in the stools, loose motion, it is dysentery. Not necessary that it has to be only with Entamoeba histolytica, it can be other parasites also. Okay? Worm infestation can lead to that. So you have to keep your gut free from all these parasites. If your gut is infested with parasites, problem. That is why frequent or at least once in 6 months a dose of anti-helminthic drugs, albendazole, deworming tablets is good. Even if you are adults, you should take it off. We don't know where all we have eaten, what kind of worms we are harboring in our gut. Alright. All the food that you eat should be to nourish your body, not to nourish the parasites. You should not nourish parasites. Whether it is actual parasites or parasites of the society. Many viruses also cause diseases in human beings. Rhinoviruses represent one such group of viruses which cause one of the most infectious human ailments, the common cold. Rhinoviruses, rhinitis, allergic rhinitis, hay fever, common cold, all of these are related to nasal infections. Rhinitis, rhino means nose. Rhine is a reference to nose. Rhinoceros, cera means horn. Rhinoceros is the animal which has a horn on the nose. Itis is a reference to inflammation. Rhinitis is also referred to by another name called hay fever. Hay fever, allergic rhinitis. Should remember this. Hay fever is allergic rhinitis. What is hay? There is a saying, no, make hay when the sun shines. What is hay? That fine dust that you will find when you harvest grains. That is hay. That can go into the nostrils and it can cause allergies. What is allergy? Allergy is a hypersensitivity reaction of the body. Hypersensitivity is what? The body is responding more than what it is supposed to respond to a particular stimulus. It is just like if somebody, you are walking on the street, you tap on their shoulder, you tap on their shoulder, the normal reaction is they will turn back to see who it is. I like looking at this. Who comes up with all this? Whoever comes up with it, write it down. Who writes this? Every day?
No, so I just wrote it yesterday or maybe day before yesterday.
Okay. So whoever comes up with the thought will write it. It is just collective effort. The pain of hard work or the stink of regret. Sitting for 3 hours in the examination hall is hard work. Sitting for 3 hours in a movie is? So is sitting the hard work or your approach towards what you do while you sit? Alright. Rhinitis done, common cold. They infect the nose and respiratory passage but not the lungs. The common cold is characterized by nasal congestion and discharge. How is it nasal congestion and discharge? Discharge is running nose, congestion is blocked nose. Can it happen? Both. You have a blocked nose and the nose is running. Does it happen? Talk from your experience. No, think from your experience. Nasal congestion and discharge.
Yes.
Possible, no?
Yes.
Passages can be congested because of inflammation of the nasal passage, which will cause swelling of the mucosa. Blockage is not because of the secretion blocking the nose. Secretion is running out. The mucosal secretion is running out, but these passages are narrow. There are so many turbines inside. There are folds inside, nasal folds. It's like when you inhale, the air is going like it's going in a turbine, like a jet. It goes round and round and round, and it gets moisturized, it gets warmer, and then it goes into the respiratory passage. However cold it is outside, this is capable of warming up the air. That is why when you do this, when you blow air into your hand, you do that now when you are during cold, you are doing it now. Warming up your hand. So these mucosal passages get inflamed because of the infection. Inflammation causes what? It causes swelling. The swelling will cause blockage. You will feel that congestion because of the swelling, and secretions are running out. That is why you will have running nose. For a very long time I used to have this confusion during school days. I would try to blow open the obstruction. No, there is running nose and there is blockage. I would imagine that the secretion is causing the blockage, and I will press this and try to blow as hard as possible. Still the blockage doesn't get cleared. Then during MBBS I realized blockage is because of inflammation causing swelling of the tissue there, not because of the secretion. So you have this oxymetazoline. Oxymetazoline, what is that? Nazibion kind of sprays and drops. It will relieve your congestion immediately. 10 seconds or 20 seconds it will relieve, and it will keep you free from nose block for 12 hours. What does that do? Oxymetazoline is an anti-inflammatory drug, antihistaminic drug. So it reduces the inflammation instantly, it reduces the swelling of that mucosal tissue, thereby opening up, clearing it. Got it? Yes. Prepare well, you will have a wonderful life as doctors. Got it? 3 months. I see a lot of anxiety in the room. Everybody is like on a stove, on a burner. Right? Very crucial 3 months. Remember your previous attempts, 1 or 2 or how many other attempts you have given. The next 3-4 months is a break or make time. Not because it will make you can prepare a lot or you will not prepare, not because of that. How well you handle your emotions for the next 4 months is what will determine how well you perform. You should become absolutely, not bothered about the outcome. You should consciously not bother about the outcome. Alright? That 134 days should make you feel excited, not afraid. I'll give my best. It's only 134 days. Okay, try to give your best. Don't worry. A lot of anxiety. I don't like anxious people. I like happy people. Alright? Even if things are going south, even if things are going down, you should be like, I will do my best, no matter what. Let's see what happens. 3 principles drive me. Number 1, there are 3 Sanskrit shlokas that will drive it. One is called Shraddhavan Labhate Gnanam Tatpara Samyate Deha Gnanam Labdva Param. Shraddha means commitment. There is no English translation for Shraddha. Shraddha means so much of dedication and commitment that you can get lost in it. That is Shraddha. Only the one who has Shraddha. Shraddha means that kind of dedication and commitment will gain knowledge. And only when you gain the right kind of knowledge, you will get eternal happiness. Happiness forever, when you have the right kind of knowledge. So, the basis of right kind of knowledge is that dedication. Then the second one is, I will not tell you the Sanskrit verse, it will make you feel. I'll tell you. Uddared atmanatmanam na atmanam avasadayet atmaiva bandhura atmaiva atmano bandhuho atmaiva ripuratmanaha. You are responsible for your destiny. You have to make yourself progress. Never curse yourself. You are your greatest enemy and you are your best friend. That's all. Never curse yourself. Don't keep telling yourself, I am useless, I am waste. You all go through that, no? Nothing is working out, I am useless. I will never be able to do that. And the third one is the most important. You have the right to perform your duty. You don't have the right to results. Karmanyevadikaraste ma pareshu kadachana ma karmapala heturubodmate samgvastva karmi. It means you have the right to perform your duty. You don't have the right over the results. Results are multifactorial. There are so many factors that will influence the results. Many times, people who will be thinking that they will get through, something happens and they will fall down. Somebody might be thinking that I have not done enough. I may not be able to cross the boundary. I may not be able to succeed. Miraculously, they will succeed. You don't know what is necessary to become successful. So don't bother about trying to find out what is necessary to become successful. Do your best. Alright? You should not stop trying because you are starting to feel that it is not possible. Or you should not start getting too hyper excited because you feel it is possible. How many times we have seen people who are winning throughout the race lose in the last mile? How many times we have seen people who in the beginning appeared to have no chance of winning, continue to run, and by the end of it, they somehow win. So till the last day, till 4th of May, just stick to the process. Don't bother. Whatever happens, happens. But happily. Okay? My energy is visible teeth. The more teeth I see, the more I work. The more gloomy faces I see, I feel like getting out of that place. Okay. Stay happy. Don't worry, we have enough time, 35 minutes. Very long time. Very long time. We started with how many days? 294 days. We are through with 160 days. So, one thing that you should feel happy about is this is going to end soon. Alright? You will get hold of your mobile phone. Earn your phone. Right. Okay. Maybe all of you get into medical college. This is off record, okay? Government might give you all iPhones. Yes. So you want that kind of an assurance to work hard? Some of the human diseases are caused by protozoans too. So we saw some of the bacterial diseases, viral diseases, protozoal diseases. Protozoans are all parasites. You may have heard about malaria, a disease man has been fighting since many years. Plasmodium, a tiny protozoan, is responsible for this disease. Different species of Plasmodium are responsible for different types of malaria. See, in malaria, the common thing is this. Know the story. Earlier, the stages of the malarial life cycle used to be a part of the syllabus. Now, of late, the stages of the malarial life cycle are not being asked so much. There are some identifiable stages, like the signet ring. There are some stages in the malarial parasite life cycle which are identifiable for its characteristics. Those will be asked. Think about the story from the time the mosquito bites a person. The mosquito bites a person. Assume that the salivary gland of the mosquito had the malarial parasite. It enters the bloodstream. It enters the bloodstream and it goes around, and blood, when it goes to the liver, these parasites will get into the liver cells. If they are not destroyed by them. The parasites gets into the liver cells, they will multiply within the liver cells for a certain stage. And once they reach a certain stage of maturation, they will be pumped into bloodstream. They will be pumped into bloodstream. In the bloodstream, they continue the next stage of development where they produce the gametes. Where they produce the gametes, male and female gametes. So when there is entry of malarial parasites into the bloodstream, when from the liver, the parasites are pushed into the bloodstream, sudden increase in the number of parasites in the bloodstream triggers immune response. What is the first reaction of your immune system? Inflammation. The first line of defense is inflammatory response. One of the mechanisms of systemic inflammation is increase the temperature. Why is the body increasing temperature? By inflammatory mechanism? To burn these parasites. Increased temperatures will reduce the metabolic activity of parasites also, many parasites. Immune system has learned that. So if you increase the temperature, the immune system gets a chance to fight these pathogens. So fever. Fever with chills and rigors. That is a characteristic of malaria. Chills and rigors is the person will start feeling cold and he will start shivering. Rigors is shivering. That is characteristic of malaria. Different parasites will have different duration of pumping these parasites from the liver to the bloodstream. So when they are pumped into the bloodstream, fever. They will again go and sequester into the liver. They will again go and sequester into the liver. But during that phase, when they are in the bloodstream, a mosquito bites, it will pick up the parasite. It will pick up the parasite. Now what is it picking up? It is picking up the gametes. In the gut of the mosquito, the gametes will fuse, they become zygote, they mature, they puncture the gut hole of the gut of the mosquito and enter into the circulatory system. You can call the lymphatics of the mosquito, outside of the stomach. From there it migrates to the salivary glands of the mosquito to be pushed into another person. This is the life cycle of mosquito. This is the life cycle of malarial parasite. Now there are different stages. Right now know the story. From the mosquito to the bloodstream, goes to the liver, grows in the liver, pushed into the bloodstream, gametes are produced, picked up by the mosquito, fertilization, further growth, comes out of the stomach of the mosquito, climbs up into the salivary gland of the mosquito, ready to infect another person. Get it? This is the cycle. Malaria can be fatal. Malaria can be fatal because of two reasons. One, it can stay in the liver. The parasites can stay in the liver. They are protozoans. They can stay in the liver and continuously keep causing these inflammatory reactions by pumping into the bloodstream. And because these parasites are getting into the RBCs, when they are pumped into the bloodstream, some of them go back to the liver. Many of these parasites will go and get into the RBCs. Their growth within the RBCs will cause destruction of the RBCs. So constantly weakening of the immune system, constant weakening of the body's responses. And with the bloodstream, they can reach the brain. Neuromalaria, brain malarial parasite can enter into the brain if they can breach the blood-brain barrier. Capillaries in all other parts of the body, are porous. Capillaries in all other parts of the body are porous, but in the brain capillaries have multiple protective layers in the capillary network. The arrangement of the capillaries is such that the capillary porosity is reduced. So that is called the blood-brain barrier. So things that are circulating in the blood cannot just cross over to the brain. They cannot cross over to the brain. Blood-brain barrier blocks it. But these parasites constantly being in the blood, if they are able to breach the blood-brain barrier, it can get into the nervous system and can cause further damage. Some other pathogens that can cause these kind of things is tuberculosis. What causes tuberculosis? What causes tuberculosis pathogen? Tubercle bacillus, that is also a bacteria. Okay, tubercle bacillus. The tuberculosis bacteria also can get into the brain and can cause brain TB, tuberculosis. Syphilis can get into brain, neurosyphilis. They are all, syphilis is caused by what? What is the pathogen for syphilis? Syphilis is a sexually transmitted disease. What is the pathogen for syphilis? Treponema pallidum. We have discussed this when we were discussing reproductive health. So these are all some pathogens which can get into brain, deadly diseases. Malaria can become deadly because of the parasite which goes into different parts, damages the tissues, damages bloodstream. Destructive pathogens. Tuberculosis can do that, and treponema can do that, get into the brain. Not many pathogens have the capacity to breach the blood-brain barrier, but these fellows have. Different species of Plasmodium vivax, malaria and falciparum are responsible for different types of malaria. Of these, malignant malaria caused by Plasmodium falciparum is the most serious one and can even be fatal. Plasmodium falciparum is malignant malaria. Fever does not come down at all. Constant fever. Okay, once in 3 days, once in 4 days, continuous fever. These are all different patterns. Let us take a glance at the life cycle of Plasmodium. Plasmodium enters the human body as sporozoites. Remember that form, infectious form. Mosquito bites and sporozoites enter through the bite of infected female Anopheles mosquito. Parasites initially multiply within the liver cells and then attack the red blood cells, resulting in their rupture. Rupture of RBCs is associated with the release of a toxic substance, hemozoin, which is responsible for the chill and high fever recurring every 3 to 4 days. When a female Anopheles mosquito bites an infected person, these parasites enter the mosquito's body and undergo further development. Parasites multiply within them to form sporozoites that are stored in the salivary glands. When these mosquitoes bite a human, the sporozoites are introduced into the body, thereby initiating the events mentioned above. It is interesting to note that the Malaria parasite requires 2 hosts, human and mosquitoes, to complete its life cycle. Female Anopheles mosquito is the vector. Vector 2. Mosquito does not cause mosquito does not develop malaria. Okay. There is a particular genetic condition. There is a particular genetic condition which provides natural immunity against malaria, which is, what is that? Sickle cell anemia. What is the, is it a chromosomal disease? Sickle cell anemia? It is a point mutation. It is a gene mutation, point mutation. What is the mutation? What is replaced by what? Glutamic acid is replaced by valine. One base pair alteration. Sickling of RBCs. Why is sickle cell anemia natural protection against malaria? Sickle RBCs cannot be infected by malarial parasite. Now, there is a correlational study also done. Malaria used to be very common in the African continent, swampy areas, and you would also see a lot of people with sickle cell anemia in those areas. Sickle cell anemia is also a problem, but malaria is deadly. Okay. So between 2 things which are harmful, you will choose the one which is less harmful. Like our elections. Correct. You are not choosing between good and bad. You are choosing between the less bad. But the bad becomes worse with power. What to do? Okay. So you first complete your MBBS, do your MD, maybe do civil services, get into governments, get into politics. Be far. Don't crib. Okay? A person who takes the smallest possible action on a continuous basis is better than a philosopher who speaks. Continuously, there are people who continuously give advice. Oh, government should do this, government should do that. What are you doing? I'm telling the government to do it. Go out and do something. Don't just keep telling. Who doesn't know what you are telling? Everybody knows what you are talking about. Anyways. Entamoeba histolytica. We spoke about it. Amoebic dysentery is a protozoan parasite in the large intestine of human which causes amoebiasis, amoebic dysentery. See, amoebic dysentery and amoebiasis are not the same. Amoebiasis is also a reference to the colonization of Entamoeba histolytica in the liver. They can cause cysts in the liver, amoebic cyst. So liver also can be damaged. Liver is a very powerful organ. It has highest regeneration capacity in the human body. But this Entamoeba histolytica can colonize liver and cause cysts within the liver. That is, it will obliterate the space within the liver, not allowing the liver tissue to function normally and cause damage. Okay. Symptoms of this disease include constipation, abdominal pain and cramps, stools with excess mucus and blood clots. Houseflies act as mechanical carriers and serve to transmit the parasite from feces of infected person to food and food products. Our friend housefly is doing the job. Simply contaminating them. Alright? It is not only Mary, we have houseflies also. Mary transmitted typhoid. Our good old friend housefly is doing the social service of transmitting Entamoeba histolytica. Okay. Drinking water and food contaminated by the fecal matter are the main source of infection. Ascaris, the common roundworm, and Wuchereria, the filarial worm, are some of the helminths which are known to be pathogenic to man. Ascaris lubricoides, we saw the roundworm. The video we saw that. Roundworms can cause ball of worms. That is the danger with roundworms. Between hookworm can cause bleeding, intestinal bleeding. Small micro bleeding can happen. Hookworm infestation can lead to anemia eventually. And all of these intestinal worms will cause malnourishment. You are paying for the food, you are getting food, cooking it, making it palatable, easy to digest, and putting it into your intestine, otherwise your mouth, passing it to the intestine to get nourished. These fellows are waiting there. Come on. You work hard, you earn, you do all the hard work. I am sitting there to eat out of it. Some similarity? Okay. Parasites are those organisms which derive their nourishment at the cost of somebody else's hard work. Like roundworms, hookworm, tapeworm, all this. I don't like corrupt people. And I just don't keep quiet, I fight. Okay. Wuchereria bancrofti and Wuchereria malayi are the filarial worms. How does this filarial worm? Okay, causes a slow developing chronic inflammation of the organs in which they live for many years. Usually the lymphatic vessels of the lower limbs, and the disease is called elephantiasis or filariasis. The genital organs are also affected, resulting in gross deformities. See, what do these fellows do? Wuchereria bancrofti and Wuchereria malayi. Sounds like some malai kofta sweets. Wuchereria bancrofti and Wuchereria malayi. They get into the lymphatic tissue. They are infected. Who transmits this? Culex. Culex mosquito transmits the microfilaria. Microfilaria is transmitted into the blood by Culex mosquito. They enter the lymphatic tissue and they will grow in the lymphatic tissue. Again, parasite. Lymphatic tissue is the one which is getting all the nutrients from the blood. You are supposed to use the lymphatic tissue for exchange of material between the that is the tissue fluid is drained by the lymphatics. If the lymphatics are blocked, if the lymphatic channels are blocked, what will happen to the fluid that comes out of the blood into the tissue space? Can it go back into the bloodstream via the same route that it came out? It comes out to the capillaries. It has to be drained by the lymphatics, taken back into the heart. But you block the lymphatics. The filarial worms block the lymphatics. So the fluid that has come out of the blood vessels into the tissue space cannot be drained. What will happen? It keeps getting accumulated in the tissue space. Now the skin and the tissue can expand when fluid gets accumulated. You see the image given there? Can you imagine why this has happened? Can you visualize why this has happened? Elephantiasis is because of accumulation of fluid, accumulation of a lot of fluid. And this is not plain water. This is not plain water. It is a serous fluid. It has a lot of dissolved substances in it. It has nutrients in it. So over time, this fluid will start getting hardened. You push more and more fluid into it, the fluid gets hardened, it will start pitting. Have you, what is edema? Edema. Edema is swelling. Swelling is called edema. When you have swelling, if you press it and leave it, many times it comes back, the skin comes back to normal. But many cases when you press it and hold it for a while and leave it, there is a pit that is formed in the skin. Have you noticed it? It's called pitting edema, commonly seen when there is renal diseases. Renal disease, and even in this, when there is long-term fluid accumulated in that particular part, you will have pitting edema. Fluid start getting crystallized. So elephantiasis or filariasis is caused by Uchularia. The pathogens are transmitted to a healthy person through the bite by the female mosquito vectors. Many fungi belonging to the genera Microsporum, Trichophyton and Epidermophyton are responsible for ringworms, which is one of the most common infectious diseases in man. Ringworm infestation. Ringworm is caused by fungus. Ringworm is what? Dry, scaly lesions on various parts of the body such as skin, nails and scalp are the main symptoms of the disease. See, ringworms, fungal infection, what do? They bury under the, and they will constantly keep spreading under the skin. Imagine some organisms crawling under the skin. Causes irritation and itching. And also they cause scaling of the skin. The skin starts getting scaled, scaling, irritation, itching, inflammation, all of that causes that ringworm infestation. There used to be an advertisement. What is that? Itch guard. There is a school playground and there is a PE teacher. He's keeping his hands in the pocket and scratching. And the students are noticing some itch guard advertisements are funny. But it is not funny for the patient. Okay, it is very embarrassing for the patient. Okay. So fungal infections. How are they transmitted? Fomite infections. Fomite means direct contact. Using sharing combs, towels, cloths, transmits. So have your own comb. You don't know who has ringworm in their head. Alright. Dandruff also, many times dandruff is also fungal infection only. That causes scaling of the skin, scalp. Scaly lesions. Fungal infections are difficult to treat. They have fungus have the ability to go into what do you call that? Inactive metabolic state, like hibernation. They will just go into an inactive state, wait for conditions to improve, and they will again crop up. So you have fungal infections, the treatment should be given long term. Heat and moisture help these fungi to grow. Naturally, wherever there is moist, like any other fungus, your mushroom grows where there is moisture and humidity. Humidity and warmth. Heat and moisture helps in the growth of the fungus, which makes them thrive in skin folds such as those in the groin or between the toes. Wherever it is warm, groin and between the toes, they can grow faster. Ringworms are generally acquired from soil or by using towels, clothes, or even the comb of infected individuals. Maintenance of personal and public hygiene is very important for prevention and control of many infectious diseases. Do you notice a lot of diseases can be taken care of with just hygiene? Hygiene. Okay. Don't you think the first few years in a child's life should be focused on training the child on how the child should take care of themselves and how they should behave in the society? Will not that take care of a lot of things? We are trying to push children into schools at the age of 2, 3. Parents are jumping with joy when their children are able to tell A, B, C, D, E, F, G. Answers. Wait for that. Teach the child how to eat, how to dress, how to take care of themselves, how to take bath, how to keep themselves clean, what not to do in public. Okay. Those are the things. Japan has one of the best education systems. Formal education begins at the age of 6. For the first 6 years of life, children are taught about the cultural values, about their social values, their personal hygiene, continuity. You see, everybody is of the same base level of decency. The base level of decency is uniform in Japan. A country's cultural development or a country's social development is measured in the baseline of social behavior of the population. What do you see in our country? The baseline varies from person to person. It is so difficult to ride a two-wheeler. There are people in the bus you have to keep looking at who will spit on you. And if somebody spits on you, you are angry about them, you will say, oh, so what? I did not see. Oh. Hygiene. These are all diseases because of poor hygiene. Measures for personal hygiene include keeping the body clean. Unfortunate that we have to write this in the 11th standard textbook. Consumption of clean drinking water, food, vegetables, fruit, etc. Public hygiene includes proper disposal of waste and excreta, periodic cleaning and disinfection of water reservoirs, pools, cesspools and tanks, and observing standard practices of hygiene in public catering. Extremely important. We have to reinforce this everywhere. These measures are particularly essential where the infectious agents are transmitted through food and water such as typhoid, amebiasis and ascariasis. See, these are all deadly diseases. They can kill. The disease load on the population is an economic drain. It is not just a disease. It will lead to a lot of financial disturbances in the families of people. So many families can be saved if you can just bring down the disease load on the families. So it's of utmost importance that everybody works on this. In cases of airborne diseases such as pneumonia and common cold, in addition to the above measures, close contact with the infected persons or their belongings should be avoided. For diseases such as malaria and filariasis that are transmitted through insect vectors, the most important measure is to control or eliminate the vectors and their breeding places. This can be achieved by avoiding stagnation of water in and around residential areas, regular cleaning of household coolers, use of mosquito nets, introducing fishes like gambusia. Important, gambusia is a question. Gambusia, it's also called, there is a common name for gambusia, guppy fish. Okay, like gambusia and ponds that feed on mosquito larvae, spraying of insecticides in ditches, drainage areas and swamps, etc. In addition, doors and windows should be provided with wire mesh to prevent the entry of mosquitoes. Such precautions have become more important, especially in the light of recent widespread incidences of the vector-borne diseases like dengue and chikungunya in many parts of India. Another thing that we notice is open sale of meat. Open roadside sale of meat. Meat handling should be, meat is dead body basically, correct? Proper handling of carcass is dead bodies is essential to ensure that the breeding of parasites and breeding of germs and other worms or insects associated with those carcasses are managed properly. We see people slaughtering animals on the roadside, letting out the animal wastes, slaughtered animal waste into the drains, on the ditches in the surroundings. There has to be policy framed where managing meat should be done properly, professionally. Slaughterhouses should have proper waste disposal mechanisms. Anybody and everybody should not be allowed to slaughter wherever they want. It is at the end of the day, it is dead bodies. Nature has its way of decomposing dead bodies. Dead bodies will trigger the growth of germs, microbes, insects. A whole lot of ecosystem is evolutionarily attracted to dead bodies. So there is a whole lot of things to be taken care of. Okay. The advancements made in biological science have armed us to effectively deal with many infectious diseases. The use of vaccines and immunization programs have enabled us to completely eradicate a deadly disease like smallpox. There are theories which say eradication is not possible, there would be transformation of that particular organism into some other form. So there is constant evolution of everything. Smallpox might have evolved into some other form, which is not causing a disease as deadly as smallpox, but might be doing something else. But good for us is, we have eradicated the disease. Alright? When we say eradication, we have to speak about eradicating the disease and not necessarily the pathogen. Alright? We are not interested in eradicating the pathogen. We are interested in eradicating or eliminating the disease from the population. Alright? Now we are on the verge of eradicating which another disease? India is free from that disease.
Leprosy.
Leprosy, okay. There is one disease against which the world has been fighting for a very long time, neuromuscular disease. Which is the disease? Polio. Polio is the neuromuscular disease which we are fighting for a long time. India is free from the disease. There are very few cases of polio being reported every year. The eradication efforts have been somewhere here and there delayed, because some cases are cropping up. Few cases, not too many cases. Pakistan has reported cases. Some other countries have reported cases. Very few cases have been reported, but as long as there are cases being reported, the disease is not eradicated. Right. A large number of other infectious diseases like polio, diphtheria, pneumonia, and tetanus have been controlled to a large extent by the use of vaccines. Biotechnology is at the verge of making available newer and safer vaccines. Discovery of antibiotics and various other drugs has also enabled us to effectively treat infectious diseases. Alright. See, before we read immunity from the book, I'll give you an overall picture of immunity. What mediates immunity in our body? What mediates immunity? Who is responsible for immunity? WBCs. White blood corpuscles. Correct? There are 5 types of white blood corpuscles. What are they? If you look at, again, granulocytes, agranulocytes. Granulocytes are 3. Acidophils, basophils, neutrophils. Agranulocytes are 2. Leukocytes and, lymphocytes and monocytes. Lymphocytes and monocytes. Correct? That's all. Now, how these 5 together ensure that the immune response is mounted against any infection. We will look at infection and we will look at how the body deals with it. We will read from the book later. An infection occurs, there is a prick, let's say there is a prick with infection. Now, as soon as there is a prick, what is happening? Prick is an injury. A needle prick or a thorn prick is an injury also, and an infection as well. Possibly infection. Let us assume there is infection. Okay? The injury is causing damage to the blood vessel. The injury is causing damage to the blood vessel. Might be some small capillaries which are damaged. Whenever there is any bleeding, it means that some blood vessel has been broken. Smaller the damage, smaller bleeding, smaller vessels are damaged. Bigger the damage, more bleeding, bigger vessels would be damaged probably. If capillaries are damaged, bleeding will stop spontaneously over some time. In about 2 to 3 minutes, you will have the bleeding stop. If you move the hand violently, it will again start. In about 8 to 10 minutes, the bleeding will completely stop. So what is happening in the first instance is formation of a temporary clot. When an injury happens, to seal off the bleeding, to seal off the damaged blood vessels, who comes in first? Who comes in to seal off the damaged blood vessel? Platelets. Platelets will aggregate together and seal the damaged blood vessel. That is the temporary clot. Now, once this is initiated, there is a cascade of coagulation reactions that will happen. There is a coagulation cascade. Many clotting factors, so many proteins are activated, so many things are there. Calcium is also a part of the coagulation cascade. That coagulation cascade will eventually lead in the end to the conversion of fibrinogen to fibrin. So overall, so many things happen that will bring fibrinogen together. Fibrinogen will form a mesh, interlocking mesh, and final activation of fibrinogen to fibrin leads to the formation of a permanent clot. Then there is clot retraction. It is like you create a mesh of fibers, threads, and you start pulling the threads from the ends. Then what will happen? The mesh will get tight. That is sealing of the injury. There are two mechanisms for sealing the injuries. One, platelet mediated temporary clot formation, or it's also called platelet clot. And the second one is permanent clot formation. Permanent clot is a fibrin clot. Temporary clot is a platelet clot. So remember these two. Platelet is a cell. Fibrinogen is a blood protein. There are three blood proteins. What are the three blood proteins? Albumin, globulin, and fibrinogen. Albumin's job is to maintain the osmotic pressure. Albumin is a primary osmotic substance of the blood. It will maintain the blood volume. Plus, albumin helps in the what? There is one more important mechanism in which albumin is a mediator. Heme metabolism, transporting biliverdin and bilirubin to the liver. Albumin is the one along with which bilirubin conjugates. Albumin will conjugate with bilirubin and transports it to the liver. So albumin with bilirubin with albumin is conjugated bilirubin. That will transport bilirubin to the liver. So albumin helps in heme metabolism. Albumin helps in maintaining the osmotic pressure within the blood. It is the osmotic substance. So if albumin levels go down, there is more fluid loss from the blood into the tissue space. So it's all connected. If kidney becomes damaged, albumin will start leaking out of kidneys. If albumin leaks out of kidneys, what will happen to osmotic pressure within blood? Osmotic pressure will reduce. If osmotic pressure reduces, the volume of blood will come down because blood will tend to get out of the blood vessels, leak out of the blood vessels. Where will it leak out into? The fluid from the blood will leak outside of the blood vessels to tissue space, Now if the fluid that is leaking out of the smaller blood vessels is within the normal range, that gets drained by the lymphatic network. If the fluid that is getting drained out is more than the range of capacity of the lymphatics to drain, what will happen to that fluid? It will start getting accumulated in the tissue space. If the fluid gets accumulated in the tissue space, what will happen to that tissue? There will be swelling. Where is the swelling more likely to happen in this case? In the peripheries or in the center? Peripheries. So, somebody with kidney failure might have a swollen leg. Correct? You understand the logic behind the swollen leg? Albumin. Alright. So it's just a deviation because we came to fibrinogen. Fibrinogen is one of the three plasma proteins. Albumin is associated with all of this. Fibrinogen is associated with clotting. There is a condition called DIC, disseminated intravascular coagulation. It is an abnormality where fibrinogen keeps getting activated for no reason. Abnormal activation of fibrinogen. What will it lead to then? Fibrinogen, if it gets activated, it becomes fibrin. Fibrin is sticky. It will stick to each other and start forming small clots inside the blood only. Disseminated means spread out. Intravascular means within the blood vessels. Coagulation means clotting. DIC, very dangerous condition. So that let it be. So fibrin should not be activated unless stimulated by platelets in the sequence of coagulation. So many coagulation factors are there. Thrombin is also one of the coagulation factor. Thrombin is produced by thrombocytes. Platelets produce thrombin. So it's all, see the interconnectedness. There are so many blood cells. All of them are interconnected in various functions. Alright. So when there is an injury, thorn prick happened, platelets are helping seal it off. There is an injection, there is an infection. Infection leads to the injury will also lead to something else. Injury or infection. It will stimulate neutrophils. Neutrophils are the first ones which will start crawling to the site of injury. They are all flowing in blood. All these blood cells, all these WBCs are flowing inside the blood. They are the constant flow with blood. Whenever there is a damage, whenever there is a trigger, whenever there is a damage because of injury or infection, that particular site of damage, infection also is a damage only, no? Infection cannot happen just like that without disturbing the tissue. There is some microscopic level of damage there. Bacteria or virus, whoever is trying to get into the tissues, are damaging the tissue at that site wherever they are entering in a microscopic way. Now that microscopic trigger is enough for that microscopic trigger is enough for the neutrophils to get activated. So in the flow, all cells are flowing. Neutrophils will start going towards the wall of the blood vessels. They go towards the wall of the blood vessels and start flowing along the wall of the blood vessels. And wherever they find the gap, wherever they find the damage, they will start squeezing out of that damage to the surrounding space. They will squeeze out of the blood vessels to the surrounding space. This squeezing out is called diapedesis. Remember, diapedesis, D-I-A-P-E-D-E-S-I-S, diapedesis. Diapedesis is the crawling out of neutrophils into the tissue space where inflammation, where injury or infection has happened. Now neutrophils are the first responders. This is non-specific response. There are two types of immune responses, non-specific immune response and specific immune response. Non-specific immune response is also referred to as innate immunity. Specific immune response is referred to as acquired immunity. Or non-specific is also referred to as passive immunity. Specific is also referred to as active immunity. So there is non-specific and specific, passive, active. Alright, innate, acquired. Perspectives, how you look at it. Non-specific means what? It doesn't matter what is the infection. What only matters is there is an infection. So the response will be as much as whether there is a infection A or infection B. There will be no change in the response when it is non-specific. But when it is specific, repeat infections will cause more aggressive response. The initial infections will cause a lesser response. If the same thing again infects, repeat infection will cause more aggressive response. Further repeat infection will cause even more aggressive response. So specific is active, meaning it gets angry, the immune system gets angry. Remembers, you are not supposed to come, I have noted you, please don't come again. Second time it comes, didn't I tell you not to come? No. Next time it enters, get out. Vaccination. When you give the first dose, you are exposing the immune system to the pathogen. Immune system remembers. Booster dose, it becomes more angry about the pathogen. Further booster, final booster, whatever is the higher level of booster doses you give, the immune system becomes very, very aggressive towards the pathogen. Anytime this pathogen comes, it will kick it out. You are training the immune system to develop the active response. So if we look at the story, neutrophils come out, they start attacking the pathogen. Let us say now there is a bacterial infection, neutrophils are coming out, neutrophils will start catching the hold of it and start eating it. Neutrophils do phagocytosis. They do phagocytosis, that means they will eat away the pathogens. They will bite and kill. Neutrophils are small cells. There are two types of phagocytes in our body. One is neutrophils, which are also called macrophages. Another cell gets activated. In the same way, when neutrophils are activated, there is one more cell that gets activated. The other cell that gets activated is monocyte. Monocyte is a very important cell. Monocyte is inactive cell. They don't have any function as such. Now this monocyte at the site of infection transforms into macrophage. Sneeze. To save you all from the torture of listening to sneezing over speaker, I took it out. Monocyte becomes macrophage, and macrophage also goes and does the phagocytosis. So these two fellows are trying to eat away as many pathogens as far as possible. Now when these two fellows are eating away as many pathogens as possible, some of the macrophages will transform further. They will transform into a specialized cell called, some of the monocytes will transform into specialized cells called APCs, antigen presenting cells. Antigen presenting cells. Now what will these antigen presenting cells do? They will go and stimulate the lymphocytes. Lymphocytes are the mediators of specific response. They go and tell the lymphocytes, boss, somebody has come. They are the messengers. Antigen presenting cells are the messengers. They are not just telling somebody has come, they are carrying them. Antigen presenting cells, the bacteria which has come, it is the antigen. They are carrying the body, trophies. See what I have got. Now here, lymphocytes are two types. T lymphocytes and B lymphocytes. T lymphocytes are the old warriors. They will use physical weapons to kill. They have swords called perforins. What will the swords do? What will a sword do? What do you do with the sword? You will perforate the body of the enemy. T lymphocytes are doing that only. They have perforins, proteins, very hard proteins. They use that and perforate the cells of the pathogens. B lymphocytes are modern warfare. They have modern warfare techniques. They produce chemicals, chemical warfare. They are experts of chemical warfare. They are the ones capable of producing antibodies. What are these antibodies? Globulins, immunoglobulins. IgG, IgA, IgM, IgD, IgE. There are 5 classes of immunoglobulins. Albumin is taking care of the volume. Fibrinogen is trying to keep the blood inside the blood vessels by sealing off all the damages. Globulin is participating in immune response. All the 3 proteins, very important. So now these antigen presenting cells are bringing the antigens or the pathogen to the lymphocytes. T lymphocytes have one master of this orchestra, helper T cells. Helper T cell will come and see. He will look at it. Okay? Memory cells, come here. Memory T cells. Now this fellow helper T cell will also activate the plasma cells. B lymphocytes are of 2 types. Plasma cells and memory B cells. Plasma cells and memory B cells. Plasma cells are the active ones. You can consider memory B cells are like blueprint. Memory B cells are the blueprint. Plasma cells are the factories which will produce the product of the blueprint. Memory B cells will keep the blueprint for producing antibodies. When they come to the factory and start producing, they are called plasma cells. Plasma cells are the ones which are producing antibodies. So now, coming back to the story from the beginning. Infection, neutrophils went to the wall, diapedesis, get out of the blood vessels, reach the site, start phagocytosing. The basophils also go. Basophils will release inflammatory mediators, histamine, serotonin, bradykinin, many chemicals which are inflammatory mediators. What these inflammatory mediators do? They will make the blood vessels bigger. They will cause dilatation of the blood vessels. When the blood vessels are dilated, what will happen to the pores in the blood vessels? Will it become smaller or bigger? They become bigger. Now more neutrophils can squeeze out. Along with neutrophils, these monocytes also will squeeze out. What are these two fellows doing now together? They are feasting on the pathogens with both hands. Okay? They are feasting on the pathogens. Some of the monocytes are transforming into APCs, antigen presenting cells. They are carrying the dead bodies, going and delivering into lymphocytes. Helper T cells takes it. Helper T cell makes two calls. One call to the memory cells in the T cell department, and one call to the memory cells in the B cell department, B lymphocyte department. Now both the memory departments are activated. Now there is a scanning of all the memory files. Is there anybody who has already dealt with these fellows? Is there anybody who has already dealt with these fellows? Somebody comes up on the T side, they will say, boss, I have already dealt with him. I know how to do. I know how to kill. I already have all the weapons ready. Can I get into production? Helper says, okay, get into production. Memory cell comes into production. It will start transforming into killer T cells. It will start transforming into killer T cells. Now these killer T cells are the warriors with the sword. They directly get into action. They get into the bloodstream, looking out for all these fellows. They find somebody there, catch hold, kill. They take the sword again, keep moving around. Keep moving around. Wherever they find the pathogen, catch hold of it, kill. Such a satisfying job. T cells have a very satisfying job. The more and more it kills, the more aggressive it becomes. Now it is not finding anybody. No more pathogens. But it is catching the sword and running around everywhere. Helper cell tells, killer, your job is done. Come back to the headquarters. Killer is already very excited. He tells, what? Helper goes back. Helper makes another call. This fellow is the master of the orchestra. Correct? If you are a teacher and the school kid that you are teaching is not listening to you, what will you do? Whom will you call? Parents. Wait, I'll call your father. Alright. Sometimes it may be the reverse also. If you are a terrorizing teacher, parents will call you. So now this helper will activate which cell? Who will reduce the aggression of the killer? There is one more T cell. Huh? Suppressor T cell. The job of the suppressor T cell is to calm this fellow, who? Killer. So there are 4 types of T cells. Helper, who is the master of the orchestra, he is the one who will activate the killer T cells. He is the one who will activate the memory B cells. That department will tell you what happens. Here you understood? Now, this is when somebody is already known. If none of these people already have a ready-made weapon to kill these fellows, what will you do? The one with the weapon which closely resembles this fellow's target points will be activated, and he will go and helper will train him. Helper will give him all this information, and the closer weapon is modified to become the specific weapon. Alright. So let's say if this is a weapon with a triangular head, it's already there, but nobody has a triangular head weapon. The target point, the antigen is a triangular head. You have to attack the triangular antigen, but nobody has a triangular sword. Somebody has a square sword. So that fellow is the closer one. You pull him and he will modify it and make a triangular sword. Now this weapon, this perforin, is used specifically to kill. Now after all this is done, a few of them go into memory. A few of the killer T cells will transform into memory T cells. Now what happens? One more antivirus added. It's like antivirus updation on your computers. You have a set of viruses, computer viruses against which you already have antivirus. If some new virus is coming, you will study that and you will build antivirus for that also. Next time that will not be able to do anything. So repository built. 4 types of T cells. Helper T cell, who is the most important fellow. Killer T cell, who is the one who is in action, who is on the field. Memory T cell, who is the one who remembers and activates the killers to multiply and go and attack. Suppressor T cell, who is very important, who is the one who will put sense into the killer and brings him back to normal state. Alright. On this side, in the B department, what happens? Helper is activating the memory cells. Now these memory cells will go to the complete records, checking for already available antibody against the antigen of the pathogen. Same case, if antibody is already available, it is already some pathogen which you are exposed to, those memory cells will transform into what cells? Plasma cells. Those memory cells will become plasma cells, and these plasma cells will multiply. Plasma cells are the ones which are capable of producing antibodies. Plasma cells will not go carrying the antibodies. They will only multiply. They will produce antibodies and release the antibodies into bloodstream. Release the antibodies. Unlike the helper, unlike the killer T cell, they don't go around looking for the pathogen. Now these chemicals are looking out for the matching chemical. What is the antibody looking for? Antibody is looking for antigen. Where is the antigen? The antigen is on the pathogen. Antigen is on the pathogen. So whenever they both affinity to the antigen, whenever the antibody finds an antigen, it will bind to it and neutralize it. Pathogen is killed. So this is specific response. Now tell me, is it easy to attack somebody to whom you already have a ready-made antibody, or is it easy to attack somebody to whom you have to make an antibody? It's easy to kill somebody against whom you already have a weapon. So that is why subsequent exposure will lead to faster response and bigger response. The first exposure will lead to slow response, because in the first exposure your body should identify it, your immune system should identify it, find out which is the matching antibodies and which is the matching killer cell, and modify their proteins, develop the ability to produce antibodies and perforance here, and then go and attack. But in the second exposure, there is already prior experience. So you have to mobilize the already available resources to build antibodies and perforates. Subsequent exposure, even bigger response, faster response. The logic behind vaccination is this. What you will do is, you will expose the body to antigens of the pathogen. It can be the entire bacteria or virus. It can be live pathogen. That is, you are giving the live bacteria or the live virus. You have not killed it. But live attenuated. Attenuation means inactivation. You have made them inactive. You have removed their ability to cause disease. But they are living. It's like you are infecting the body with vaccination. You are infecting the body with vaccination when you are giving live attenuated vaccines. But those pathogens cannot cause disease. You have made them inactive. Alright? They cannot do anything to you, but they are live. Your body gets exposed to that. Those were all first generation vaccines, where you are giving live vaccinations. Next is killed vaccines. Killed vaccines means you kill the pathogen. They are not living, but you give the whole pathogen. Complete dead bodies you are supplying to the body. So the body will identify all the different antigens on that particular pathogen and develop immune response against it. Next is, another type of vaccination is, you give the toxin produced by that pathogen, like Clostridium tetani. The bacteria does not do anything to you, but it is the toxin produced by the bacteria which causes the disease. So what do you do with the tetanus vaccine? You expose the body to inactivated toxin, and you are making the body develop resistance against the toxin. The bacteria doesn't do anything. Because if you attack the bacteria, see why toxin, immunity against toxin, why not kill the bacteria only? Like others. It is the bacteria which is producing the toxin, tetanus toxin. To immunize against tetanus, why are you producing antibodies against the toxin? Produce it against the bacteria only, no? If there is no source, where will be the consequence? Isn't it? But why are we developing vaccine against the toxin? Any logic? When threatened, Clostridium tetani releases the toxin. That means, have you come across insects? There are some insects. They are going around everywhere, they are there. If you touch them, it will release some pungent chemicals, which will cause very bad odor. Very pungent, bad odor producing chemicals. Otherwise they are around only, but you don't have that odor. If you touch it, it will instantly release these odor producing chemicals which will repel you from that insect. You don't want to touch it. Clostridium tetani is like that. If the immune system goes and tries to attack it, before it is dead, it will release the toxin. Toxin is the one which will cause damage to the body. So if you train the immune system to kill the bacteria, there is no point, you cannot protect the person from the disease, because when the immune system tries to kill it, it will release the toxin. Toxin will go and bite to the muscles and makes the muscles fix in contraction. Tetanus disease will still happen. So trying to kill the bacteria is of no use. You have to make the body not get affected by the toxin, because killing it will release the toxin. You understand? So toxoids, those vaccines are called toxoids. Toxoids are such vaccines which are vaccine against toxin. So we looked at 3 types of vaccines. First is live attenuated vaccine. The pathogen is living, but you have made it inactive. The second type of vaccination is killed vaccines. Whole vaccines, these are called whole cell vaccines, not wholesale vaccines. Whole cell vaccines. Okay. They are complete cells. These are all earlier vaccination methods. They will create a bigger immune response, because there are multiple antigens against which the body will develop immunity. That will lead to vaccination induced immune response, fever, some discomfort, all of that is possible in these vaccines. Toxoids are vaccines against toxins. Next type of vaccines are part vaccines. Part vaccines are you will isolate single antigens or 1 or 2 antigens from the pathogen, and you will make that as the vaccine. So you are stimulating the body to develop immunity against specific antigens. The immune response will not be so much to cause discomfort to your body. But I personally feel whole vaccines are more potent, because they will make you develop immunity against the range of antigens of the pathogen. Now these new generation vaccines that we are building, they are all specific antigen vaccines. Alright. Now even more, the next level of advancement has gone into vaccine production, where we are producing edible vaccines. Edible vaccines might come into picture very shortly. What are edible vaccines? By using biotechnology, you are developing the antigens of these pathogens in edible items, like banana with typhoid antigen. You eat that banana, your gut develops immunity against typhoid. Typhoid banana, take it. Okay. Polio, orange. You just eat that orange, it's like taking polio drops. No, polio orange is not being developed. Typhoid banana is being developed. I don't know about polio orange. Imagine it, so cool, no? So much advancement is happening. You are able to modify, manipulate, mix and match, it is as scary as it is exciting. Because humans are learning to manipulate nature. Humans are learning to manipulate nature, and this ability to manipulate nature is coming at the ignorance of the interconnectedness of nature. We will never be able to understand the complete interconnectedness. Changing something somewhere might have an impact on the overall ecosystem, on the overall life on the planet, which we are not able to understand. We are manipulating. We learn how to do this. Oh, it's exciting. We will use that to intervene at that particular level. But at the end of the day, all of us have to die someday. We will have fun playing with the tools we can create using this. Alright. In between, we will do some climate conference, talk about climate change, put up some posters, put up status updates, and feel good that we are being responsible. Correct? You do all that you want to do, and every now and then you do some social media activism, and you wash out all the sins of manipulating nature and destroying the ecosystems. Right? There is some statement our Prime Minister has given somewhere. He says, you wake up in your posh home, drive a car to the gym, use electricity to walk, treadmill. Okay? Come back, freshen up, use the car to go to a 5-star hotel in an air-conditioned hall using a lot of electricity. You talk about climate change. So you're going to a conference on climate change, doing all of this. Such hypocrisy. So vaccination, immunization, all of these principles we discussed. What each of these immune cells do, we have discussed. Now we will read what is given, and then we will try to put it all together. See, antibody molecule structure is given. There are 4 chains, 2 heavy chain and 2 light chains. If you look at it, there is the antigen binding site. Antigen binding site. Those terminals, the antigen binding sites, are the ones which will alter according to the antigen. So if you already have, it's like lock and key. Antigen antibody is like lock and key. Assume the antigen is the lock and antibody is the key. Helper T cell is like the keysmith. What he will do? He will first try to find out whether there is an exactly matching key. If he finds an exactly matching key, he will send it for mass production. Helper T cell will activate mass production of that key. Plasma cells will mass produce here. The memory cells will transform, and killer cells are mass produced on that side. If you don't find an exactly matching key, what do you do if you are as a locksmith? What do you do? First you will take a template, no? You will take a template. If it is a small lock, will you take a 2-inch long key to alter it? You will use that. You will use the template which is as big as the keyhole, as wide as the keyhole. Then you will try to shape it according to the lock. That is what this does. The antigen binding sites are modified. It is like altering the key template to match the lock exactly. So for every lock there should be a key. Your specific immune response is like a key manufacturing factory. It is like a key manufacturing factory. Its job is to ensure that whenever a lock is available, whenever a lock comes into the picture, it has a key to go and bind to it. You bind it with the key, the lock becomes useless. Lock is the antigen which is on the pathogen, key is the antibody. When there is a match binding, the antigen becomes bound, the pathogen becomes useless. The body is protected. So, locks come into picture, locks come into the bloodstream, check for available keys. If there are keys available, mass produce, send the keys to bind the locks. If the keys are not available, find the template which can be used to make the key, mass produce, send it, bind it. Every time you make a key, you store that key as a reference. So that next time the same kind of lock comes in, you have a key which you can directly pull out and mass produce and send it. That's all. Imagine how many thousands of keys you would have made, lakhs of keys you would have made. One advantage of being in India is we get to manufacture many keys. Alright. If we go to any Western countries, we are happy, we can roam around happily, no problem. We will not fall sick. Why are Indians ruling the entire world? Western world is being ruled by Indians. You go there, cold, hot, whatever is the weather, we can adapt. We don't fall sick. Why? We are a massive repository of keys, antibodies. Our immune system is super strong. It's like the West Army. They come here, have you seen? Americans or Europeans coming into our country, traveling in our places as tourists. They will be using double masks. They will be walking on their toes. No, not to blame them, they are not used to it. If they start living like us here, they will complete their travel in the hospital. They come here, go out for a walk, rest in the hospital, go back. That is their immune system. So what do we do? So we should be happy. Alright. Many opportunities I have got to go out and work, out of the country. But it is my pledge not to go out of the country for work. There is no stamping, there is no visa in my passport yet. Okay. Never I will go out to work. But this is fun. Driving is so much fun. To go out on an Indian road. You don't need any other entertainment. It's like you are in the middle of a circus. Look at those roads that they show, American roads, 100 feet wide. Your car is only 5 feet. You just need 10 feet width of the road. So you are almost on the last inch of the road. And somehow we cross. 100 feet road, wide road, feels sleepy. Anyways, immunity. Socially, we are immune to all the problems that humans might face. We don't have money, we are happy. We don't have resources, we are happy. We share, we care, we live, we know how to live. 10 rupees, we will still live. That's all, okay. Immunity. Every day we are exposed to large number of infectious agents. However, only a few of these exposures result in disease. Why? This is due to the fact that the body is able to defend itself from most of these foreign agents. This overall ability of the host to fight the disease causing organisms. Some other stories are coming in. Avoid your waste time. Immunity is of two types: innate immunity and acquired immunity. Innate immunity is non-specific type of defense that is present at the time of birth. How did we get it at the time of birth? Evolution. Millions of years of evolution has made certain immune responses inbuilt. We are born with some range of stop please. Okay. Alright. This is accomplished by providing different types of barriers to the entry of. Everybody lost it now. See, uncontrollable laugh or cry is a response to pent-up emotions. That is what it is. Okay. This is accomplished by providing different types of barriers to the entry of the foreign agents into our body. Innate immunity consists of 4 types of barriers: physical barriers, physiological barriers, cellular barriers, and cytokine barriers. Physical is our skin and mucous membranes, prevents the entry of microorganisms. Mucus coating will trap the microorganisms. Mucus in the respiratory passages, all the passages, wherever there is entry points for entering the body, there is mucus which will prevent the entry of these pathogens and trap them. Like epithelial lining of the respiratory, GI, urogenital tracts, and also help in trapping microbes entering our body. Physiological barriers like acid in the stomach, saliva in the mouth, tears from eyes, all prevent microbial growth. There is a specific chemical in the tears. What is that? Tears have some antibacterial chemical. What is the antibacterial chemical that we have in the tears? Lysozyme. Lysozyme, ZYM. That is an antibacterial chemical that is present in tears. Your eyes has very thin mucous membrane, exposed to the surroundings, exposed to the outer world, very moist and warm, very it's a conducive place for bacterial growth. Such a beautiful design. Your eyes are like culture medium for bacteria. If not for the lysozyme present in the eyes, it would have become a breeding ground of bacteria. So your tears will ensure that the bacterial growth does not happen. Alright, it has lysozyme, very important. Isn't it? Unlike your skin, it is very thin. The mucous membrane of the eyes is very thin, the conjunctiva is very thin. Alright, in spite of that, infection can happen, conjunctivitis, redness of the eyes, all of that. Cellular barriers, certain types of leukocytes, WBCs of our body like polymorphonuclear leukocytes, PMNL, that is neutrophils, polymorphonuclear leukocytes, and monocytes and natural killer cells in the blood, as well as macrophages in tissues can phagocytose and destroy microbes. What are natural killer cells? Natural killer cells are specialized type of cells. Again, monocytes transform into NK cells also. Natural killer cells will identify abnormally transformed cells in the body. What are abnormally transformed cells capable of becoming? Cancer cells. So these natural killer cells go around in the body looking for abnormal transformation in cells. So any abnormally transformed cells are identified and killed. Very important. Just because the cell belongs to your body, if it has abnormally transformed, it is important to eliminate it. You don't protect it. Abnormally transformed cells, if it is not eliminated, it will lead to destruction of the body itself. It is like abnormally transformed individuals. Just because the individual is a citizen of our country, if he is abnormally transformed, meaning if he has developed the transformation that can make him cancerous. Cancerous is destroy the country itself. So somebody who has transformed into a criminal, somebody who has developed terrorist tendencies, somebody who has developed the inclination to destroy, whoever it is, friend, family, whoever it is, we have to stop them. We have to stop them and we have to regulate them. We have to, if need be, bind them by law. Otherwise, such are the people who will be dangerous for the country. Such wonderful lessons in immunity. See, immune system is designed to identify foreign objects and eliminate them. Ensure that the foreign objects or the foreign cells do not cause harm to the body. What if the own cells become abnormal? They also have to eliminate. Okay? Natural killer cells do that. In the blood as well as macrophages in tissues can phagocytose and destroy microbes. See, all these cells, if you notice, all these cells are functioning by producing a lot of chemicals. Now that means all of these cells have to have an optimum level of metabolism to ensure their adequate functioning. Metabolism is chemical reactions dependent on enzymatic machinery. Enzymatic machinery is the functioning of enzymes is dependent on the cell's ability to produce these enzymes. What is necessary to produce the enzymes? What do you need to produce the enzymes? Proteins. What do you need to for the enzymes to function properly?
Coenzymes.
Vitamins and minerals. You see the importance? Just taking care of protein, vitamin and mineral supply to the body, you are not just making the body stay healthy, but your immune system will be active. Long duration of deficiency, long duration of damage to the cells because of lack of nourishment will lead to permanent limitation of functions. So just take care of your nourishment, everything else your body is capable of taking care of. That's all. It makes it so easy. Makes it so easy. But we are not able to control our desire to eat. That is what will lead to most of the problems. That's what they tell, no? There is a saying. I don't know whether it's there in any other language. There is a saying in my language. Maatu ballavaniಗೆ ಜಗಳವಿಲ್ಲ, ಊಟ ಬಲ್ಲವನಿಗೆ ರೋಗವಿಲ್ಲ. That means somebody who knows how to speak has got no quarrels. And somebody who knows how to eat has got no diseases. That's all. If you know how to eat, you don't get diseases. If you know how to speak, you don't get into quarrel. Cytokine barriers, virus-infected cells secrete proteins called interferons which prevent non-infected cells from further viral infection. Again, interferons, important chemicals. Interferons are interfering chemicals. Chemicals which will interfere in the binding of viruses to the host cell. So if I am a host cell, I have been infected with viruses. I know where the virus attacked me. So before I am killed, what I do, I will produce a chemical, interferon, which will block the site where the virus attacked me. Let's say there is some protein A to which the virus binds and punctures the cell and gets into the cell. So what does this cell do? It will produce an interferon which will bind on that protein A, making the protein A unavailable for the virus to attach to. If the virus cannot find an attaching site, the site to hold on to or puncture the cell, it will not be able to enter the host cell. Block the entry point. So this cell is dying, but it is producing a chemical which will prevent the other cells in the surroundings from getting affected. That is how your respiratory illness, your rhinitis, common cold, all of that gets recovered by that. Some of the cells are affected, they produce interferons, they try to protect the other cells, but by that time other cells are also affected. But the process of producing interferons and trying to protect the surrounding cells continues, and over a period of time, the virus will lose, which is trying to protect all the surrounding cells. Virus is hitting a dead end. Alright? Such kind of a behavior, trying to protect others in the face of destruction of self. What is such behavior called?
Sacrifice.
Sacrifice is okay. It's called altruism. Altruistic behavior. Altruistic behavior is you put yourself in you put others' welfare before your own survival. Altruistic behavior is displayed by deer. So if there is a bunch of deer going in the forest and a lion attacks, if you notice, the older ones will be at the back and in the front. The younger ones will be in the middle. So wherever the predator attacks, the older ones are putting themselves in the line of attack, so that the younger ones are protected. Younger ones can run away faster. If it tries to catch up, the older ones will slow down to submit themselves. So it's a wonderful word out there. Survival is such an important factor. Survival is such an important factor for every organism. No organism takes its own life so lightly as human beings does. You look at even an ant, it is trying to do all the right things to ensure its survival. Human beings are the ones who will put themselves into all sorts of survival threats, starting from what they eat, how they live, their habits, their behavior. Some emotional disturbances, they go and kill themselves. Dogs are putting their heads in shame because of humans. With whom are we loyal? Alright. Innate immunity, done. Acquired immunity on the other hand is pathogen specific. We already discussed that. It is characterized by memory. This means when our body encounters a pathogen for the first time, it produces a response called primary response, which is of low intensity. Subsequent encounters with the same pathogen elicits a highly intensified second or anamnestic response. Anamnestic response. Amnesia means what? Amnesia, loss of memory. Anamnesia means no loss of memory. Anamnestic response means a response where memory is not lost. Remember and hit. I remember you. I hit. That is the anamnestic response. This is ascribed to the fact that our body appears to have memory of the first encounter. The primary and secondary immune responses are carried out with the help of two special types of lymphocytes present in our body, B lymphocytes and T lymphocytes. The B lymphocytes produce an army of proteins in response to pathogens into our blood to fight with them. These proteins are called antibodies. The T cells themselves do not secrete antibodies but help B cells to produce them. Which T cell will help the B cells to produce antibodies? Helper T cells. HIV goes and attacks the helper. HIV goes and attacks the helper T cell. So if you consider immune system to be the one which will keep the entire body healthy and active, helper T cell is at the heart of it. So if you equate the immune system to if you equate the body to the country, immune system to the entire government machinery, helper T cells are the elected representatives and the higher bureaucracy. The IAS, IPS, IFS, those kind of bureaucracy. Not the lower bureaucracy. Not the chaprasi kind of bureaucracy. Alright? Corruption is the HIV which attacks the helper T cell. If that is attacked, the entire immune system is destroyed. If the immune system is destroyed, the entire body is finished. Alright? So people who are corrupt are like HIV virus. Okay. The B lymphocyte, that is there, no? Each antibody molecule has 4 peptide chains, two smaller ones called light chains and 2 longer ones called heavy chains. Hence an antibody is represented as H2N2. That means 2 heavy chains and 2 light chains. Different types of antibodies are produced in our body. GAMED. GAMED. You can remember it that way. IgG, IgA, IgM, IgD, IgE. IgM is the biggest. IgG is the smallest. IgG can cross placenta. Should remember. IgG, immunoglobulin G, can cross placenta. It can cross placenta. Alright? When the IgG is responsible for erythroblastosis fetalis. Not the, erythroblastosis fetalis. Erythroblastosis fetalis is because of Rh antigen antibody reaction. Alright? Hemolytic disease of the newborn. Rh negative mother, Rh positive baby. During the terminal stages of pregnancy, placenta becomes breached and the baby's RBCs can enter the mother's blood. Baby's RBCs can enter the mother's blood. Mother's blood does not have Rh antigen. So when the mother's blood gets exposed to Rh antigen, what will the mother's immune system do? It will produce antibody against Rh antigen. What is the nature of antibody? IgG. It can cross placenta. So it can enter into the baby's bloodstream. And when the antibody to Rh antigen enters the baby's bloodstream by crossing the placenta, what will happen in the baby's body? Antigen-antibody reaction, clotting of blood. During the first pregnancy, it is the first exposure to the mother. So before the mother produces antibody and the antibody crosses over and tries attacking the baby's blood, the baby is born. But the mother remembers, the mother's immune system remembers Rh antigen. In the next pregnancy, the same thing happens. What will be the pace of production of Rh antibody? It will be faster. It will be faster, and there is all likelihood that the mother produces enough antibodies to pump into the baby's blood, which can cause varying degrees of disease in the baby. How do you prevent it? Tell the mother to have only one child? Passive immunity. As soon as the baby is born, an Rh negative mother is given Rh antibody passively. When you inject Rh antibody passively, what will the antibody do? It will go around the bloodstream trying to find Rh antigen, bind to it and catch hold of it. Before the mother's immune system identifies Rh antigen and starts producing an active response, you are pumping in antibody to remove the antigen. So the immune system does not develop response against Rh antigen. That kind of immunization is called passive immunization. Active immunization is what? Immunization, vaccination. Active immunization is you are making the body develop an immune response. Alright? You are making the body develop the antibody producing mechanism. That is active immune response. Active immunization. Vaccination is active immunization. Passive immunization is you are injecting the antibodies passively. You are injecting the antibodies passively to remove the antigen. Rabies. A dog bites. You are doubtful that the dog is a mad dog. You don't know the status of the dog. It might be it is a street dog. So the dog bites. What do? You give anti-rabies vaccination, but the vaccination will take about 7 to 10 days to take effect. But if the dog was rabid, if the dog had the rabies virus, then by the time this vaccination picks up and starts producing an immune response, the person might get rabies and even die. So when you are not aware of the status of the dog, what do? You give vaccination also. At the same time, you give anti-rabies immunoglobulins, antibody. So that if at all the dog was rabies and the rabies virus has come in, you are injecting the body with antibodies directly so that whatever rabies viruses has come in are removed from the system. You are not waiting for the body to produce antibodies. Because you don't have the window of opportunity to allow the body to produce antibodies to fight the antigen. The person might die before that. So, immunoglobulin injection. Passive immunization. Alright? Different types of antibodies are produced. A cartoon of an antibody is given in figure 7.4. Because these antibodies are found in the blood, the response is also called as humoral immune response. Humoral means related to blood. This is one of the two types of our acquired immune responses, antibody mediated. The second type is called cell mediated immune response or cell mediated immunity. The T lymphocytes mediate cell mediated immunity. Very often, when some human organs like heart, eye, liver, kidney fail to function satisfactorily, transplantation is the only remedy to enable the patient to live a normal life. Then a search begins to find a suitable donor. Why is it that the organs cannot be taken from just anybody? What is it that the doctors check? Grafts from just any source, an animal, another primate or any human being cannot be made since the grafts would be rejected sooner or later. Tissue matching, blood group matching are essential before undertaking any graft or transplant, and even after this the patient has to take immunosuppressants all his or her life. The body is able to differentiate self and non-self, and the cell-mediated immune response is responsible for the graft rejection. See, if you there are antigens on every cell of your body. Your immune system is capable of identifying those antigens as self-antigens. Self-antigens, and any cell with those self-antigens will not be attacked by the immune system. If the immune system starts attacking the self-antigen containing cells, it is called what? Autoimmunity. Autoimmunity. But when you have to do organ transplant, liver transplant, kidney transplant, which transplant has the least rejection possibility? Which transplant is least rejected? That is, it is not generally not attacked. Right? Not eyes, cornea. It is the cornea graft that you do. Eye transplant means it is not the eye transplant, it is the cornea transplant that we are talking about. Okay? Why? No blood supply. There is no blood supply to the cornea. Get it? Cornea has got no blood supply. If there is no blood supply, where will the immune response happen from? So most accepted grafts are corneal grafts. Okay. About 70 to 80% of blindness is because of corneal defects. Corneal blindness. If eye donation is done as a common practice, about 80% of blindness can be eliminated from our country. There are not as many blind people with corneal blindness in the country as probably the number of people who are dying on a daily basis. Right? So many things that can be tackled. Eye transplant, so organ transplant also is happening now. Okay. So a lot of things have to be matched before you do a transplantation. Active and passive immunity. When a host is exposed to antigens, which may be in the form of living or dead microbes or other proteins, antibodies are produced in the host body. This type of immunity is called active immunity. We have discussed all of this. Active immunity is slow and takes time to give its full effective response. Injecting the microbes deliberately during immunization or infectious organisms gaining access into body during natural infection induce active immunity. When ready-made antibodies are directly given to protect the body against foreign agents, it is called passive immunity. Is passive immunity specific or non-specific? Passive immune response is specific or non-specific? Specific. Specific and non-specific is based on whether it is antigen antibody mediated or generic response. Okay. Do you know why mother's milk is considered very essential for the newborn infant? The yellowish fluid, colostrum, secreted by mother during the initial days of lactation has abundant antibodies, IgA antibodies. You should remember IgA for surface immunity. Surface immunity, mucosal immunity, IgA. IgG is most common immunity. IgG can cross placenta. IgA causes surface immunity, gut immunity. Okay. Mother's milk has IgA antibodies. So when the baby drinks it, these IgA antibodies will provide protection at the gut level. So any infection that can happen, because babies put things into their mouth. Even very small babies are touching things and putting their hands into the mouth. Their most likely chance of infection is oral. IgA given by mother's milk, kind of positioning an army of antibodies on the gut wall to ensure that nobody can harm the baby. Alright? Remember IgA, IgG. IgM is the biggest antibody. IgM is the biggest antibody, pentavalent. Like in the diagram you saw in the previous page, there are two arms, antigen binding sites. It is divalent antibody. IgG is divalent or bivalent. IgM has 5 such arms. IgM is pentavalent. That means one antibody can bind 5 antigens. So IgM is big. IgG is active, process placenta. IgA, surface, present in mother's milk. These 3 you remember. The fetus also receives some antibodies from their mother through the placenta during pregnancy. These are some examples of passive immunity. Vaccination and immunization. The principle of immunization or vaccination is based on the property of memory of the immune system. In vaccination, a preparation of antigenic proteins of pathogen or inactivated or weakened pathogen are introduced into the body. The antibodies produced in the body against these antigens would neutralize the pathogenic agents during actual infection. Vaccines also generate memory. B and T cells that recognize the pathogen quickly on subsequent exposure and overwhelm the invaders with a massive production of antibodies. If a person is infected with some deadly microbes to which quick immune response is required, as in we need to directly inject the preformed antibodies or antitoxin, a preparation containing antibodies to the toxin. Anti-snake venom. Snake venom has so many toxins, neurotoxin and hemotoxin, 2 types of toxins. Neurotoxin will act on the nervous system and make the nervous system incompetent. Hemotoxin will cause damage to the blood cells. So both of these toxins are present in snake venom. Antitoxin, anti-snake venom is antibodies against those toxins. How do we know which toxins? You have studied so many poisonous snakes. Poisonous snakes have been studied, their venom has been studied, the chemicals in the venom has been studied. They are treated as antigens and antibodies are produced against that. Okay. Even in cases of snake bites, the injection which is given to the patients contain preformed antibodies against the snake venom. This type of immunization is called passive immunization. Recombinant DNA technology has allowed the production of antigenic polypeptides of pathogen in bacteria or yeast. Vaccines produced using this approach allow large-scale production and hence greater availability for immunization. Example, hepatitis B vaccine produced from yeast. All of you are now children are being given hepatitis B also as a part of the universal immunization schedule. Have all of you got it? Have you got it? Hepatitis B vaccine? Don't know. Hepatitis B, the modes of infection of hepatitis B is the same as that of HIV. Alright? Whatever are the modes of infection of HIV, the similar modes are for hepatitis B. But hepatitis B, the infectivity rate is higher. Hepatitis B causes infection of the liver. You cannot clear it. It is a permanent infection. Hepatitis B will contribute to the infection of hepatitis C also. Hepatitis B will make the liver develop cancer. It will stimulate development of cancer. So hepatitis B can also be deadly, like HIV. And hepatitis B has a higher infectivity rate than HIV. That means you prick a person with hepatitis B, you prick a person with HIV. There are 2 needles. 2 needles, one with blood of hepatitis B person and one with blood of HIV infected person. Assume both these needles have viruses. The viruses on this needle, hepatitis B virus, can survive longer than HIV virus. So the endurance of the hepatitis B virus is much higher than HIV. Okay. Hepatitis B vaccination is to be taken as a part of general vaccination. Allergies. When you have gone to a new place and suddenly you start sneezing, wheezing for no explained reason, and when you went away, your symptoms disappeared. Did this happen to you? Some of us are sensitive to some particles in the environment. The above mentioned reaction could be because of allergy to pollen, mites, etc., which are different in different places. We also talk about allergy to people, no? I'm allergic to. Okay. Not being able to tolerate something when it is not unusual for common people to tolerate it is allergy. Somebody is very allergy is simply hypersensitivity. In a normal environment, let's say in this room, there is dust. There is dust in this room also, and there is cold. There might be some pollen, sometimes when there is a flowering season. Most of the people are managing with that, but some people might start sneezing. Their respiratory tract might start responding to it and developing an immune response to it. So a hypersensitive response is allergy. Asthma is an allergic response. Asthma is an allergic response. Okay. The exaggerated response of the immune system to certain antigens present in the environment is called allergy. The substances to which such an immune response is produced are called allergens. The antibodies produced to these are of IgE type. IgE are specific to allergies. Common examples of allergens are mites in dust, pollen, animal dander, etc. Symptoms of allergic reactions include sneezing, watery eyes, running nose, and difficulty in breathing. Allergy is due to the release of chemicals like histamine and serotonin from the mast cells. For determining the cause of what are mast cells, where do they come from? Like monocytes are inactive and they get activated to become macrophages and antigen presenting cells and NK cells. Basophils are inactive and when they are stimulated they become mast cells and release these inflammatory mediators. Okay? Mast cells are transformed basophils. What is the precursor to mast cell? Basophils. Okay? When you have running nose, when you have sneezing, what is the tablet you take? Does any of you remember? Cetirizine. Any of you recall that name? Cetirizine, CPM, chlorpheniramine maleate. Cetirizine is an antihistamine drug. Histamine is the inflammatory mediator produced by these mast cells. So if you reduce this histamine, then you will your hypersensitivity response comes down, inflammatory response goes down. Okay, your cetirizine is antihistamine, and histamine and serotonin are the most common inflammatory mediators produced by what cells? Mast cells. Where are they coming from? Basophils. All right. For determining the cause of allergy, the patient is exposed to or injected with very small doses of possible allergens and the reactions are studied. The use of drugs like antihistamine, adrenaline and steroids quickly reduce the symptoms of allergy. Somehow, modern day lifestyle has resulted in lowering of immunity and more sensitivity to allergens. More and more children in metro cities of India suffer from allergies and asthma due to sensitivity to the environment. This could be because of the protected environment provided early in life. Alright. So, autoimmunity, immune system in the body, cancer. Protected organs. Tomorrow also we will have to continue with this. Alright. Big chapter. Tomorrow we will continue with this chapter. Probably we will complete this tomorrow.